Hi everyone, this is Dr. Erdoğan by Smile Hair Clinic. Today we would like to talk about some previous patients of our clinic. So we will explain what we did, how is his result, and how it was the progress. So let's start and check for the patient. Valentin is 3,600 graft patient, which is done in 2022. He admitted to our clinic that he needs just the frontal part. As you see, he has a bilateral recession in the temporal part, and also some density, low density appearance, especially miniaturization in the frontal part. In the patients like this, of course, in the male pattern baldness I'm talking about, which is occurring the 90% of all hair loss problems. In these conditions, we see bilateral recessions with the patients, and the hairline is becoming irregular, hairline is becoming receded and thinner. Thinning means miniaturization, it's the same word we are using, and it is depending on sometimes mostly DHT problems, DHT related problems, which is the hydrotestosterone, and it's called androgenetic alopecia, and sometimes it is due to hormonal imbalances, vitamin deficiencies, stress relations, sometimes the circulation problems. In this kind of age, like 30s, we don't expect that kind of thing. So it's a typical male pattern baldness that we see. After this part, we usually mostly see the temporal recession is merging to the other side. So it has not occurred yet. And also we don't see too much crown area problem. So let's go further with the other photos. Okay, so we decide about the hairline together with the patient always. Of course, we have some recommendations depending on their ages, depending on their hair style, hair type, also the face type as well. But we decided a little bit more. It may look a little bit straight in these photos, but it's just one dimension and we can't see the sides. We will see with the previous photo with a better appearance, like it's more roundy. In every patient, we always want, if it is getting matured, the hairline should little go up in the temporal parts, which is occurring in this patient. But that is something we decide with the patient together. So this is his hairline. I think he, as far as to my notes that I talk with the patient, he wanted to lower the frontal part a little bit, so we give a little tricky part in this part. So it looks like it is a lowering effect in the frontal part. We do it sometimes with the patients who is lowering the line, but not the whole line. Sometimes with those peak patients, and sometimes the patients who just want not a very straight line. Okay, so this is how it appears from the top. As you see, he has a very good donor area. The donor area looks pretty much nice, thick. We examine according to our notes. He has multiple hair majority. Also the thickness is good, but we don't have any crown area problem, just maybe some parts. In this kind of patients, we always want to check if the crown needs some graft implantation, if there is a possibility to do the penetration. If not, we do not do that. So that's how it is ended up with the frontal density. So 3,600 graft is a little bit, of course, could sound much for the patient, but we are following the right guidelines to optimum hair density implantation. So for us, it's always between 45 to 55 follicles per centimeter square. In this patient, of course, the middle part that he has some hairs there, we always protect those hairs because it's important for us to protect those hairs. We just penetrate between those hairs and we give a cumulative thickness to that area. But of course, these areas are more important, the temporal parts. It was receding, so more density, 55 nearly, but in the center, we did a little decrease numbers. The total frontal part was nearly 80 centimeters square. So it's pretty much, we covered some of the hairs there. And of course, with the zigzags, with the irregularities, we also give some different angles as well. So most of the patients ask us the same question: how do I look like after the transplantation? So that's a typical example of how you should look like after this period. So 2 weeks later, 13 days almost, we always want patients' photos to evaluate. We have a post-op team which is requesting photos from the patients regularly, and it's pretty much good. I mean, he's still not removed his scabs. That's the reason there are some scabs on his head, which we do not want after the 10th day normally, but after it's removed and it looks more clean, I think it has a better appearance now. It has a little bit with scabs, but we want patients after 10 days to remove those scabs. 1 month. In the first month, I mean, also it's very good to see something here that you just see like an island area. Here he had hairs, as you see in the previous photos, but he has a longer hair that covers that part. He has some hairs, it has not still merged, but we can see it right now when the other hairs grown. In the first part, if he has no long hair, it means that he has some lower density appearance. That's the reason that's a big area, and that's the reason we did this graft number to him. By the way, his donor area looks very good at that time. As you see, it is already recovered and looks good. Okay, let's go further with the other photo. 3rd month, it is more visible right now. Yes, we see sometimes shock loss with some patients in these areas, but this is the typical, he was like that before when he came. When we shaved, it was also looking like that. He has temporal recession, he has a longer hair filling this part, but we filled all the hairs. His hair, the existing hairs is growing. Our hairs is not grown, not started yet. It will be better. And in the 3rd month photo, as you see, donor area looks very good. 6 months, I mean, almost he has gotten the almost the full result. His donor area looks pretty much very good. That it looks like it has no any transplantation. Here in the photos, sometimes we cannot select very rightly because of the photo resolution. Sometimes the angle. I can see some skin through here, but even now the patient is happy according to his feedbacks to us in the 6th month, and in the right side it looks very good too. So now we are in the 9th month, which we wanted to see most of the progress. Donor area is looking very good. The frontal part is looking very nicely. From the side also it looks very good. He has a different style right now. He was covering the front to cover everything. Now he has a good density, so he's making upwards. It's good. And the last photo that we can show you, still good crown, very good density. You can't see the skin through. And he's still very proud of his hairs, and he's doing a good style. So we are very happy that the patient is happy too, and he is having a good success result with us. So hopefully every patient we want to give the similar results. Sometimes it's not very possible due to his baldness, his donor area capacity, his age, his many other conditions underlying. But please, if you have some concerns or if you have some doubts or questions, please let us know. We would like to answer you as a hair loss and a hair surgeon expert. Thank you for watching.